Muy buenas tardes a todos. Les
Good
saluda.
afternoon to everyone. This is Carla Ruiz of Castilla from Latin American Organization Against Lung Cancer. And today we are going to talk about the detection about cancer, lung cancer, and how to help patients with lung cancer. This is the agenda. We're going to start with Maria Gabriela Bertarte, FUCA from Argentina, who will be presenting to Dr. Claudio Manter, who's manager in Alexander Fleming Institute in Argentina. He will be talking about the experience in Institute Fleming in Argentina, and after our second talker will be the exposition of the Briseida Castillo um, with the Dr. Alicia Van Der Lutt Munoz, who is a doctor from Costa Rica, with the topic about what is the support that the multidisciplinary equipments give to the oncologist. And finally, Adriana Garzón will present us to Dr. Felipe Cardona Zorrilla, who will be talking about how we can extend life from patient with good practice in Colombia and Latin America. This is our agenda, and now we're going to listen first to Maria Gabriela Berta from FUCA. We are happy to have you here. Good afternoon, Carla. Good afternoon, everyone who is listening to us. It's a pleasure and it's an honor for us to receive the invitation to participate for this so important event. I would like to use this opportunity to mention that FUCA is a foundation to avoid cancer, and it has his headquarters in Alexander Fleming Institute in Buenos Aires. And our organization is focused on helping others in oncologist medicine. We have much more than 100 doctors who develop in different points of all Argentina, and nowadays we have some oncologists in other countries of the region who had been specialized in the Fleming Institute that we have available.
Finalidad.
And
Así que bueno, invitarlos a todos también.
we want to invite everyone much more from our foundation and their different activities that we have. And now I'm going to introduce to Dr.
Realmente para
in
nosotros.
Alexander Fleming Institute, and for us as FUCA, we have a big honor to present him. And now again, thank you, Dr. Martin, for being here with us in this opportunity, in this training, and in this workshop that we have for all Latin America.
Bueno,
Le paso al doctor Martín.
muchas gracias.
Thank you, Maria Gabriela, and thank you for all the organizers from this meeting. I'm going to share my presentation right now.
¿Por qué ahora no está? Sí. Perdón.
Sorry.
Ahí no se ve, ¿no? Todavía.
You don't see my presentation yet, isn't it?
A ver si así la puedo compartir.
Now we can share it. Do you see it now?
Si alguien me...
If someone could tell me.
Hola.
Hello?
¿Ahí se ve bien?
Can you see it?
Bueno.
Todavía no, doctor. Se ve solamente.
Not yet, doctor.
Perdón.
Sorry.
No se preocupe.
Don't worry, doctor. It's okay. Sorry, I just seen perfectly.
María Gabriela
On the
Berta,
meantime, we are going to thank Maria Gabriela Berta, who is a lawyer, executive director from the cancer organization FUCA.
Science, en Derecho Corporativo,
She's specialized in
ha liderado grupos multidisciplinarios con alto nivel de compromiso.
leading different multidisciplinary teams, and she has a big
Y ha sido
job
fantástico.
in leading the doctors in FUCA. She has been training different doctors who
Especializadas en la atención de pacientes
can have a specialized attention in oncology science. Now, can you see it?
¿Ahora sí?
Sí, doctor.
Yes, doctor.
Adelante.
Muchas gracias por
Thank you.
darme estos minutos de indecisión.
Thank you for your patience.
Yo voy a hablar de...
I'm going to talk about
son los pilares de los
what are
tratamientos.
the foundations of treatment today for lung cancer. First, what requirements an excellence center need to have? You need to have human resources very well qualified. But even when this is not a qualification,
No es lo único.
it's not the only thing that we need to think about. For example,
Fleming,
I work in Alexander Fleming Institute as well as a public hospital. The same group of multidisciplinary,
los cirujanos,
the different
oncólogos,
surgeons, the oncologists, we are the same group in both institutions. But sadly, the other support team, it also needs to be there to consider a place as an excellent center when it's related to lung cancer. When we talk about the hospital, for example, in my case, we don't have tomographies, we don't have different interventionism. What else do we need to have? It's also the multidisciplinary job is very important. I'm not going to talk about much about it, but also pictures, tomographies, resonance, those are very important equipments. Interventionism, the capacity to make biopsies with tomographies or different pictures, pathologies. Today, molecular pathology is fundamental. The possibility to do translational medicine, to exchange knowledge in whole Latin America, to apply it to the patient, also surgery, immunotherapy also, the opportunity to do clinic tests in Latin America, it's not so available, the medicine. That's why it's hard to be leading in new treatments. And it's also hard to offer to the patient therapies that not only standards, they are hard to access due to our situation in Latin America. And those things are key to make a center excellent in lung cancer. The Alexander Fleming Institute is a private center linked to the University of Buenos Aires. Today, we do almost 150 chemotherapies per day.
Hay 100 camas de hospitalización.
There are 100 hospitalization units beyond the beds that we already have, and also for patient post-surgery. We also have an area designated to molecular biology and tumor markers and for transplants, and we also have pictures. We have PET, CT, RMM, mammographies, and we also have equipment that is very sophisticated in interventionism to obtain tissues from our bodies. And we have two equipment of radiotherapy, And we have the most modern variables in immunotherapy. Now, all these conditions had helped us to improve the life on the patient. And we also have a program of screening in the institution for patients that have high risk, people who were smokers. And we have three very important aspects: precision therapy, immunotherapy, and clinic investigation. Therapy precision is what had helped us during the last evaluation of death in lung cancer. It helped us to see that we have reduced the death in a 6% compared with previous years. And this has been attributed to the precision therapy. What does it mean, precision therapy? It means to localize the different molecular change that it has in the body, the cancer, to help it to improve. This shows that the patient that has a molecular change in their tumor, they live longer than those that doesn't have a known mutation, or those who doesn't receive the therapy for any reason. This had allowed us in the last decades to evolve hugely, and now we can say that half of the patient, we can say that we can identify a mutation that can be treated, or that soonly is going to be treated with a directed therapy. If we see this test of directed therapy in this year, we can see a big many types of drugs that have been approved for the FDA in short time. Surely we're going to have much more medicine available. We face different challenges, but the reality is that this is a fundamental foundation that we need. All these centers of high complexity had helped the patient, and we can find a very useful therapy nowadays. And luckily, we have panels of new generation, they are called that way, that help us to detect different genes simultaneously. This has been a big change in the possibility to help us detect the different molecular changes and to treat them appropriately. And another big advance that we have made is in therapy. We commonly use biopsy, which we can search for change in the molecules and to make a diagnosis from the tumor. But lately it had been moved forward, and we have the opportunity to do a clean biopsy, which means to search for different genetic changes, and with only one blood extraction, we can investigate different molecular changes that we have and that impact hugely in the treatment of the patient. Now I'm going to show some cases of patients that you can see or have an understanding of what these therapies are. This is a patient from 56 years that she never smoked. She was a teacher from, and she had this mutation from Jim who has FGR. She had metastasis, cerebral metastasis. She has a lung lesion, and as you may know, the treatment of cerebral metastasis is very dangerous. So in 2019 August, the patient has this mutation that we could detect, and she had a directed medication to this mutation. 2 months after, now we can observe is that there was a big reduction in the cerebral lesions, and some of those problems had almost disappeared completely, and the lungs were improved as well. And some of the conditions that she had were improved. They improved notably. She had one complication that it was solved easily. She restarted the treatment, and the patient continued without several problems, without lung problems. Now she had 2 years. She had lung cancer with metastasis, with several metastases. We can see how all these treatments change notably the expectation of life. This is a different case who is a doctor from 36 years old. We did the normal molecular test, and this person received immunotherapy, and the immunotherapy helped for 5 months. Then the tumor progressed again. He entered in a clinic test, what we had available for those patients who resist to immunotherapy. And after 3 months, the sickness progressed again. On that moment, we did this process that we talked up before. We used his blood to discover what genes he had on his blood. And in 2019 is where we start using this new technology. And we discovered this new mutation called RET. In that moment, we had this new drug called anectinib. And now we have new medicine, new drugs that had been developed to help these cases. The patient had different bone lesions. He had several metastases, and he started with this medication, selpercatinib. And we asked this to the lab, and 2 months after, the patient almost had a completely heal of the bones and notably mentioned in the brain and in the lungs. And today, 2 years after, the patient continues with the treatment with selpercatinib, and he has a normal life and he continues working. And that's the importance of how all the process, how all the disciplines together, the multidisciplinary, change the life expectations, especially in young patient and very active. An other big pillar in the immunotherapy is another, at least is one of the pillars, the immunotherapy. It consists in how the tumoral cells are different from normal cells, and how they are different is like a virus. These cells, these antigens, they can be recognized by the cells, other cells in our body, and program our immune system to destroy the tumoral cells. This normally occurs with virus, with bacteria. We have points of control, some points in our body that made that this immune answer, it's not bad for us and it doesn't affect us. So this point of control are used by the tumors that produce proteins that turn off these control points. Some of these points are called PD-1, and they do that our immunodefense answer are turned off. So what the immunotherapy does is they enter in the process and they stop the tumor. And in that way, we can make that our own defenses destroy the tumors. And these are medicines that have been developed recently. All of these, obviously, with that multidisciplinary teamwork. For example, this is a case from a patient from 70 years old who had metastasis in his neck and also in the suprarrenal glands. who had a PD-1. We use the PD-1 in this case, and he received a very high doses of these drugs in April 2018 for 2 years until April 2020. He had a complete separation of the tumor, and from April 2020 until today, a year, and without treatment, without sickness. So it has been 3 years for patient with metastasis. Is almost impossible thing a few years ago. Another important pillar is the clinic tests. It helps us to have data, and it helps us have new options for the patients. Today we have 8 clinical tests. We are helping people who has been pre-chemotherapy, after the therapy. We have new therapies as well. And now we have new treatments for patient who has been resistant to immunotherapy. And I finished with this, and I hope that this has been helpful for you.
Muchísimas gracias al doctor.
Thank you, Dr. Claudio Martin. Now we're going to remember that Dr. Martin is clinic oncologist. He used to be on scholarships in the FUCA. He worked in Institute Maria Ferrer in Argentina. We have a question. Dr. Martin, do you think that we should follow this path of multidisciplinary team in general in cancer, or for lung cancer specifically? Is different for lung cancer? Could you share your vision about this, please? Well, if you work in multidisciplinary, that is key. With all the things that I have mentioned before, especially in pathology, in surgeons, in pneumologists and internist, without the molecular pathologists, without the molecular biologists, without that team, it's impossible to do or to obtain all the updates that we had in these treatments in lung cancer. The individual, it's very difficult to treat a patient without support. Let's consider that a patient with lung cancer is someone who is sick, who smokes, someone who has hypertension, someone who has emphysema, also who has problems in the heart. And we need all that I have mentioned, and as well we need an evaluation and groups of pneumologists, cardiologists, because these drugs have certain effects. We also need endocrinologists, we neurologists. It's to work in the interdisciplinary, it's fundamental. I have different groups, and sadly in the hospital it's a little more difficult, and you can notice that it's hard to help the patient. That's why the multidisciplinary in related to lung cancer, it's essential. Without multidisciplinary help, it's not possible that the patient had the best help possible. Can we talk about excellent center in Latin America? What would be for you the best experience in Latin America according to this? Well, in Latin America, there are different excellence centers. As I have number from my point of view, there are certain requisites that you need to have a center that you call an excellence center. There are different centers. For example, Center Dr. Cardona, centers in Chile, in Brazil, or in Argentina. But I feel that we still are missing, especially in the public sector, to be able to have a better support when it comes to lung cancer. When we talk about the public sector, we have different limitations in the multidisciplinary work to obtain pictures in time and form, because a different thing is to have available the technology, but it's also important to have it fast. Patient with lung cancer cannot wait 2 months to make a test or months and a half to have a biopsy. We have Center of Excellence in Latin America, but we obviously need much more. Mhm. I totally agree, Dr. Martin. I will open the space to see if someone in Zoom has a question, or maybe in the streaming in Facebook. Okay, I feel that it's really clear. We we want to thank you, Dr. Martin. Thank you for opening us a space in all the time that you are really busy to help in this Latin American group, to help in lung cancer. We are a group of patients that we work to have rights for the patient who have lung cancer in our different countries, and we do this together to inform and to understand the topics that are needful to understand. And we have invited you, and thank you for your brilliant exposition about the excellence centers and to help patients with lung cancer, and about thank you for telling us about your experience in the institute, Dr. Martin. Well, now I would like to invite to Briseida Castillo from Anasobi, and also to
La señora Briseida Cantillo.
and now we want to talk a little bit about her. Briseida is president from Anasobi, National Association Second Opportunity of Life. Anasobi have more than 10 years fighting for the rights from patients with critic sickness and chronic sickness. Now we're going to present Ana Gloria Romero. She came to help us from the National Red of Cancer in Costa Rica. Thank you for your help in our fight against lung cancer. She coordinates the National Red Cancer of Costa Rica, and she's president of BioRed CAC Foundation. And all of us in Latin America, we have followed as an example from experience and good practice to open and other places like this in our region. And we want to welcome Ana Gloria again. And now we're going to present Dr. Alicia Van Der Lutt. Please go ahead, Briseida. It's a pleasure to be able to present Dr. Alicia Van Der Lutt. She is a doctor and oncologist. She helps patients with lung cancer and between other sickness. She works as an oncologist in the Mexico hospital, one of the important hospitals in our countries, and she works on this in Costa Rica. And doctor, it's a pleasure to present you. Hello, good afternoon. Thank you for the opportunity. Now I'm going to share my screen.
Bueno, espero que ahí estén pudiendo ya verla.
Well, I hope that you can see it right now. It had been asked to me to talk about how the multidisciplinary equipos can help the oncologists. And to develop this topic a little bit, I think the question that we should ask is how the multidisciplinary equipment improve the patient expectation, and if it helps us as doctors or specialists, but the real end is the patient. We know that this month in November, it has been celebrated that International Day Against the Lung Cancer, and the reality is that the fight that we have in this sickness is hard. I imagine a little bit in this cyclism from the bottom, from this mountain. I imagine the the task to try to go up in this mountain, not only because it's really high or because it's really difficult to ride in this difficult climate with different paths. The reality is that when we have a patient with lung cancer, this is the scenario. It's not an easy scenario. It's a complex case. It's something that we need to be able to accept as a team, not on solitude, because the one who's going to suffer at the end is the patient. Some arguments that support how we need to help the patient as a team is because this type of tumor, it's very lethal. It's around the 20% of deaths in the world. But not only in the world, the lung cancer is a high rate of death in our countries, in South America, in Central America, and the Caribbean. And definitely, it worries us a lot to the oncologists and those who treat this patient. Something very interesting is that the age of the diagnostic is they are adults. When we talk about lung cancer, we imagine someone who smokes, but the reality is that there is a very big number of patients who are young, very functional with families, with younger children, with those who we want to help much more. 4% of the patients who have been diagnosticated with lung cancer are less than 40 years old. Something that is very evident is where the anatomy where we develop this lung cancer. Let's remember that the lungs help us to create the exchange of CO2 and oxygen, and the lungs have certain organs close to it, for example, the pleura or the ganglios, who are in the middle of two lungs. Maybe we cannot see it in this picture, but the heart is close. We have also different blood vessels, and that means that the location of this sickness has a very big complexity. And we need to decide and to help because it's a complex topic. It's very important for the oncologist to decide what is the stage. We need to talk with the patient and to explain what stage of the sickness they are. And absolutely, the stage where they are is what is going to decide how they are going to be helped and if they're going to survive. And if you see in different stages, the numbers are darker, depending if the sickness is big or is small, if the sickness is in the ganglions, and that's how this to be alive, it's compromised in short term and in long term. So to decide and to determine the stage is really complex because it implies different specialties like radiologists or magnetic resonance, and it's not so easy like one x-ray in the thorax and to see what stage the sickness is. Another thing that put this situation hard is that if we would like to help everyone to be localized in stage one, where the supervision is bigger, sadly, most of the patient is going to be receive a treatment when they're in metastasis. It's hard with this sickness to be recognized early. Sometimes we don't recognize any symptoms, but when we recognize the symptoms, it's most likely the patient has the sickness advanced, and sadly, the risk of death is going to be bigger in this patient. Probably you know this, but I want to mention that the risk factors for lung cancer also made it a very complex sickness. The tabacism is one of the main reasons for lung cancer, and is a challenge for the insurance centers and for our centers to help these patients. All of us know that it's something really complex, but beyond that, we want to tell you that in all the diagnosticated patient, 35% don't have a history smoking, but there is an important number that doesn't smoke, and this lead us to much more complexity because obligate us to find different options of treatment because we know there are different type of treatments that can help people who know to smoke, who don't smoke. We know that there are other different factors that different to control and difficult to prevent because these are life factors that are not so easy to control. And remember that around 35% of patients are not smokers. Why is hard to manage this sickness? Because it's hard to prevent. Tabacism is easy to control, but it's not easy to control tabacism on patients. But and reduced risk is something really complex. From symptoms, I'm not going to enter in details, but when the sickness starts, many patients don't have any symptoms. But when we see symptoms, we can say that the sickness had been advanced. We also can mention that one thorax X-ray, it's not enough. We need much more. In Costa Rica, for example, only some centers have a TAC. We don't have PAT tag, TAC, in the public sector. And if we do one solicited to make a buy about one of those, it takes like 3 months to buy one of those equipments. Magnetic resonance, it's hard to find in Costa Rica, for example. It's something hard for us. And the reality is that many receive this type of test. We also need help of make a biopsy. Radiologists can do the treatments, need to help us. And sometimes this is hard to do because it's important to talk with the head of the hospital to explain that this type of treatments need a nurse to help the patient recuperations room, and it's very sad to, for example, the radiologist is running because he doesn't know who can help the patient recover after the biopsy. And also a bronchoscopy, it needs help and professionals from the health. It takes a time, it takes a preparation for the patient, and without any doubt, specialists who have the capacity to do this type of test and also to take biopsy is fundamental. Also, in lung cancer, we have all the treatments, and we need some professionals who have fluid. Oh, professionals who find that some patient had fluids on one of the pleura, and we need to know how to do those type of treatments, and we need to train our doctors to do those. The molecular biology in lung cancer is fundamental, and the participation of the pathologist, it's it's fundamental in helping our patients, not only because the biopsy are complex, but because we need to receive a clear diagnostic, but also because we need some biomarker to help us to decide certain therapies. Where, and those treatments we're going to need blood tests. For example, because in Costa Rica we cannot use the blood for those treatments yet. We need help from the industry, from other type of organizations. There is not only one type of lung cancer. There are some subtypes. It's not necessary to give you detail of all of those, but it's important that the pathologists put a clear name so we know how we can treat the patient, because the evolution of this type of tumors, it's and how would you treat them is different. And in general, what is the type of support that we need to receive? It's different. As I mentioned to you, the stage of the sickness, the type of tumor, and the patient, how the expectation of life the patient has, what other sickness the patient has. We're going to need cardiologists, geriatrics, and other doctors. Lung cancer treatment is very different depending on what stage we are, and we need to make a big effort to help the patients appropriately. For example, stage 3 is where it's advanced. Some of the patients can be operated, but some of them will go to radiotherapy treatment. And sadly, in some countries, radiotherapy is not so accessible to start. And some of these patients waits too much time, and that is damaging for them. And in the stage 4, it's very aggressive, the sickness, and we can do that these patients live more with these type of treatments. Now I'm going to show you 2 or 3 cases very complete to see what's the difference between the impact the multidisciplinary equipments can have. We can see this man who in 1st October 2021 was 75 years old. He has hypertension. He was a smoker. He made a radiography of X-ray thorax, and that sadly wasn't correctly treated until January 10th, 2021. And at that point in time, the doctor discovered that the patient had a little mass in the lung. Almost 2 months after, he received a valoration from an intern med doctor, and that specialist make a solicitude of TAC from thorax. For April 2021, the report wasn't available. Sadly, the radiologist doesn't have too much time to report all the TAC that they do. For May, they obtain the TAC report. They have a result, and then he's programmed to bronchoscopy for May. And the bronchoscopy, a mass that was suspect. For June, the biopsy hasn't been reported yet. For June 25, we see that the ganglios biopsy, it's negative. At that moment, the pneumologist in a third place takes the patient to a session, and in the session, they made a pre-operatory evaluation, and in August 1st, all the studies were made, and now the patient entered in a waiting list to see if he's going to be operated. In October 2021, because in COVID time in my country, surgery took a long time, even cancer surgery. This patient go in October 2021, they decide to repeat the TAC because it had taken too much time. And finally, this October 17th, the patient was operated. And for the end of November, the patient received a radiotherapy because the patient did have mediastinal sickness. Initially, he didn't have, but as the time passed and passed, this was the last report. The time from the moment that this process starts and it finishes was almost 1 year. If this patient had the opportunity to be held by a multidisciplinary team at the first moment, for example, in our country, to reduce this time is something really complex, but it's hard, but it's possible. If this patient would have received help from a multidisciplinary center, this patient would have been treated by someone who knows how to treat this multidisciplinary way. It's most likely that this type of specialist would have helped them asking for the test sooner, and it would have present from the beginning to the patient in a multidisciplinary session. The time would be really short. In that session, we could see the pictures, and even if we don't have a report, we have a radiologist, someone who can tell the stage of the sickness. We can define the bronchoscopy. We ask for another reports and tests, and at the end, the patient had a diagnostic, and finally, the patient can be operated in May 15th in 2021. Now, this is another case. So it was 4 months when he was recognized from the time that it was detected, the pulmonary mass, and it was 4 months, but the multidisciplinary team was helpful in this patient. And in general, these patients who are aborted sooner, some patient who has this treatment sooner, and those who have the sickness in this stage that is lower, they can receive help in radiotherapy. And all these specialists are fundamental when helping these patients. As the doctor mentioned, also, there is a lot of investigation and some clinical investigations that want to help the patient before the surgery and after the surgery. And it's really important that this country and our countries have the will to make investigation, which is important. This is a different case who is a lung cancer in stage 3. We can see that it's hard to have surgery to this patient, but many of these patients need to go to chemotherapy or radiotherapy. And also we have immunotherapy after the chemo or radiotherapy. Let's see how this patient, younger from 55 years old, he was a smoker. He saw that he had some signals in October 2021, and it's when October 1st when he went to talk to a service of emergency, and they decide to enter to the hospital. It's not a specialized place. It's treated as a severe pneumonia. They made different studies and they noticed that he had a lot of ganglios, and they send it to the high complexity hospital, and after 1 month the pneumologist evaluate him. He is sent the oncologist, and now let's notice how the months pass until finally he reached to the oncology center. But he reached there without test, but we don't know if he has metastasis or not yet. The oncologists need to ask for these studies, and it's from January 17th January when this patient received the help that he needs with radiotherapy or chemotherapy, but it's needed the TAC study before of it, because sadly we don't have so much help in radiotherapy in our hospital. But we need to start with chemotherapy while we wait for the radiotherapy, because that is not ideal, because the ideal is that the patient receive both treatment together, but the reality is that sometimes we need to act differently. For May 2021, the patient has a partial answer to the chemotherapy. He received a radiotherapy after the chemotherapy, which was not ideal. And finally, he talked in oncology in August 2021. The ideal in this patient is to offer immunotherapy when he or she doesn't progress when they receive chemotherapy or radiotherapy. But basically, to this patient, the insurance rejected that to him. If this patient would have been tested in a multidisciplinary team, for example, if this presentation would have made in a virtual presentation, but if this hospital could have contact with a high complexity hospital and through Zoom they could have discussed this case, pues, well, for in that case the evolution of this patient would have been faster. They could have defined that he needed radiotherapy and chemotherapy, which was ideal. He could have obtained urgent appointments with the patient without the need to travel kilometers to reach to the hospital. And the patient could have been able to receive an appropriate therapy. This patient could receive chemo and radiotherapy and the immunotherapy, and the time was shorter from the time that the patient reached to the appointment, and he only had to wait 2 months to receive his treatment and to finish this advanced stage. Even when we cannot cure the patient in this stage, they have opportunities to control the symptoms, to improve quality of life and time of life. And we have different options, as Dr. Martin mentioned before. And basically, we need to say that we need to work with palliative medicine. And we also have chemotherapy, which is a help. It's also in the time of the personalized medicine, which are certain genes, altered genes, which we can fight with medications that are much more tolerated than chemotherapy, and where the expectation to life is bigger to the patients. And it's important the clinical tests, which are trying to help us to approve new drugs. And this is the classic case from one patient who could have a molecular analysis to her tumor and who had this mutation, the ALK, who was offered a medication called alectinib, who helped her to reduce the metastasis, the cerebral metastasis. This was much more different than other drugs. The patients now that receive ALK allocated, they have much more expectation of life. For example, for the PDL1, we need pathologists with experience to give that to patients. Now, if it's a patient with a developed stage, they need help. They need equipments, multidisciplinary equipments. And they need radiologists, they need analysis, diagnostic analysis, they need biopsies. There are different personalized therapy, but we need the therapy close to us. And if we help the patients like this, multidisciplinary, we're going to help the patients much more. But as the environment could look different, but it's better as a team. Thank you and good afternoon. Thank you, Dr. Alicia Van Der Lutt. Doctor, I have one question. We had talked a little bit about the treatments from which the patients can be benefit with lung cancer. For example, the immunotherapy. Now, the patients that need the immunotherapy, they need the PDL1. For example, what is the percentage that the percentage of patients that can be benefit from the immunotherapy? Well, it's important, as I mentioned in the presentation, to see the stage of the sickness. The immunotherapy had his approbation in advanced stages in lung cancer in cells not small. And it's likely that many patients can be beneficiated, but the PDL1 is going to help us to predict that there are some patients that have much more opportunity to have answer to these drugs. But the PDL1 also could help us to know much more if some patients don't need chemotherapy, but only immunotherapy. It will be much helpful in some cases with other sickness. It's been said that around 40% of patients has a high exposure to PDL1, but that's going to be different depending on the region where you are. For example, in Costa Rica, we have not had many patients with PDL1 high, but probably in other places where there is a place where there is a lot of smokers, it probably goes to 30%, but also depending on where we are, we're going to have a high probability of have biomarkers or directed therapy. For example, in Costa Rica, around 25% of patients have mutations in AGPR, which give us a great opportunity to treat patients with directed therapy. So it's important to have data from our countries and to open more opportunities to these patients using these markers. Perfect. Now, to understand a little bit more the context in Costa Rica, how much time have you been helping the patient with lung cancer? Well, it's been a long time, 8 or 10 years. We had helped the patient in multidisciplinary teams. Alessandra, could you confirm me if you have, if someone has any questions? I think that Fanny Romero from Mexico want to make a question. Yes, thank you. Taking this opportunity, there are some patients that have asked us if it's possible that we could transplant the lung, and if it's that's possible, how is the percentage of progress with this type of
Sí,
treatments,
la realidad
or
es que no es algo, no es
well,
algo que
the
hagamos
reality is that it's
usualmente en
not something
oncología,
real that we
¿verdad?
do, especially in
El trasplante de
oncology.
pulmón normalmente
The
se ofrece para
lung
otras
transplant
enfermedades,
is
pero
offered
en
for
oncología, por
different
lo menos, nosotros no tenemos la
sickness, but not for
experiencia,
oncology. We don't have
ni
that
es
experience,
algo en
and
lo cual
it's not
pensamos en
something
estos
in what we
pacientes,
think.
¿verdad? Lastimosamente, la
Sadly,
enfermedad
the sickness,
metastásica
the metastasis
y la
sickness,
capacidad de
and the
regresar
capacity to
en otros
return
órganos,
in other
esta
organs
enfermedad es muy
is
alta, la
very
probabilidad que
high,
esto
and
suceda,
the
¿verdad? Es
probability
una
to
enfermedad
occur
que
this,
a pesar
and
inclusive
it's a
de que se
sickness that
opere y se
even when
trate
we
localmente,
made a
existe alto
surgery,
riesgo de que esta enfermedad
we
futura
have a high
regrese.
risk to return.
Entonces, la verdad es que
So the truth
en mi
is,
caso no
in my
tenemos esa
case, we don't
experiencia
have that
y es algo que
experience,
tampoco
and
se
that's something
describe
that we
mucho
don't
como
describe
una
too much
oportunidad para estos
as an
pacientes.
opportunity for the patients.
Perfecto,
Perfect,
doctora.
doctor.
Muchísimas
Thank
gracias.
you.
Estuvo con nosotros la doctora
This
Alicia
was
Van Der
Dr.
Lutt,
Alicia Van Der
especialista
Lutt,
en medicina interna y oncología
specialist
médica, que labora
in
como médico
intern
especialista en
medicine
CINCA,
and
Centro de
oncology,
Investigación y Manejo del Cáncer, y a
in
nivel público en el Hospital de
and works in
México,
the
San
public
José,
center
Costa Rica.
of
Gracias,
a
doctora, por estar
hospital,
con nosotros esta tarde.
San
Muy
Jose in
agradecida
Costa
por todo lo
Rica.
que ha
We are
compartido
grateful
y
for
hasta
all
la
that you have
próxima oportunidad.
done for us.
Muchísimas
Thank
gracias.
you. Until the next
Inmediatamente, por
opportunity.
favor,
Now,
damos la
immediately,
bienvenida
we're
a
going
la
to
señora
welcome to Adriana Maria Garzón.
Ella es
She's
sobreviviente de cáncer de
a
mama hace
survivor from
19 años y fundó
cancer,
la Fundación
and
Simon, que significa
she
Sinergias para el
founded the
Mejoramiento del
Simon
Manejo
Foundation, which
Oncológico
means
en Colombia.
improvement of
Bienvenida,
oncology
Adriana Garzón.
manners
Muchísimas
of
gracias por estar con
integrated
nosotros.
synergies.
Gracias, Carla.
Thank
Gracias
you,
por este
Carla.
espacio
Thank you
tan
for this
importante
space,
y
so
qué bueno
important,
ver
and
tantas caras
it's so
conocidas,
happy to see
miembros de Ulacpul y sobre
so
todo
many
presentar este médico tan excepcional.
known faces, and especially it's special to meet or introduce to you this
Carlita,
special
tenemos
member of an special doctor.
la diapositiva del doctor Cardona.
Carlita, do we have the presentation from Dr. Cardona?
Okay,
Okay,
voy a ir
perfect.
presentando al doctor Cardona.
I'm going to be
Les quiero
presenting
decir que
Dr.
él
Cardona,
es
and
el
he
médico
is
que
the
cualquier
doctor,
paciente quisiera tener,
the doctor that any patient
además
would like to
de
have.
los innumerables
Besides the
títulos que
many
tiene
titles that he
el
has, Dr.
Él es
Cardona,
médico,
he's a
obviamente graduado en
doctor
medicina
graduated in
interna,
intern
es
medicine,
oncólogo
he's
clínico,
oncologist, a clinical
dentro de
oncologist.
sus títulos
Inside
está
of
una
his many
maestría en
titles, he has a
epidemiología de la
master
Universidad de
degree in
Sevilla, en
epidemiology in
España,
Sevilla,
adicional pues
Spain.
el
He
doctorado en
also has
genética
a
de tumores
PhD in
con
tumor
énfasis en
genetics
medicina de
and emphasis
transmisión.
in
El
translation
doctor Cardona
medicine.
pues ha sido profesor en diferentes
This
universidades,
doctor has
entre
been
ellas las
teacher
muy
and
prestigiosas
professor
en
in
Colombia como la
many
Universidad
universities,
de los
like for
Andes, el
example, Los Andes
Bosque,
University,
director
El Bosque
de la revista
University. He
ha
has
sido
been
director de la
director
revista
from
colombiana
the
de
Colombian magazine
y
Cancerology
de otras
and
revistas,
other
ha sido
magazines.
editor
He has been editor,
y pues
and
actualmente él es el
nowadays he
director
is the
de investigación
investigation
y
and
educación en el
education
Centro
director
de
in the
Investigación y
Center of
Tratamiento del Cáncer
Investigation
Luis
and
Carlos
Treatment
Sarmiento
of
Angulo,
Cancer, Luis
el
Carlos Sarmiento
CETIC,
Angulo.
una institución que
Is an
estará a la
institution
vanguardia
that
muy
is
seguramente en
leading
la región
this
en
region
temas de
when it
oncología.
comes
Está
to
casi que
oncology
inaugurando
topics.
este
So he's
gran centro. Le auguramos
starting
muchos éxitos,
all
doctor
these
Cardona.
things. So
Lo
a
quiero
lot
con todo
of
mi
success
corazón,
we
muy
give
feliz
to
de verlo acá en
Dr.
pantalla.
Cardona, and we are
Bienvenido.
happy to have you here.
Muchas gracias,
I
Adriana,
really
por
admire
la
you with all
presentación.
my heart. Thank you,
Y por
Adriana,
sus
for
generosas
this
palabras.
presentation and especially
Les pido que me confirmen
your
si están
words.
viendo la
I ask you
presentación.
to
Si le
you
dan
to
a
confirm me
compartir, pero
if
no sé
you
si la
are able
están,
to
si la
listen to
están
me.
observando. ¿Se ve correctamente?
Can you see it properly?
Sí, doctor, se ve,
Yes,
se le
doctor,
escucha
we can see it and
perfectamente.
listen to
Bienvenido,
you
gracias.
perfectly.
Ok,
Welcome,
perfecto.
thank you.
Trataré
Perfect.
de ser lo más básico posible para
I will
poder
try to be
transmitirle a
the
toda
simpler
la audiencia y especialmente
possible,
sabiendo que es personal, no
knowing
sanitario,
that
sino personas
this is
que
not people who
adicionalmente
are
tienen un
doctors, but
vínculo
people
con
who
nosotros
have a type of connection
enorme y
with
que
us,
obviamente esperan
and
tener
you
las
hope
mejores
you
noticias
have the
y la
best
mejor
news
perspectiva
and the
respecto a
best
su enfermedad.
perspective according to
Entonces
their
voy a mostrar
sickness.
algunas cosas
So
que
I'm
para
going to
nosotros son
show you some
importantes
things that
esto, que
personally for
seguramente la
you
gran
are
mayoría de los
important.
pacientes no han tenido oportunidad de ver. Voy a
Probably
tratar de plasmarlo de la
many
forma más
patients have
sencilla
not
para que todos
had the
ustedes lo
opportunity to see these
comprendan.
things, but
Trataré de
I
hacerlo
will
muy
try to
gráfico
explain it
para que
very
les explique. Si
graphically
ustedes
so you
observan
can
en la
understand
porción
it. If you
superior de la
can see at the
diapositiva,
top,
lo que ustedes ven son
what
múltiples
you
curvas.
see are
Para nosotros estas
multiple
curvas son
curves. These
importantísimas
curves are
porque son
important for
curvas que nos
us
permiten
because these
diferenciar
curves
las
help us to
posibilidades de vida que
differentiate
tiene un paciente
the
alrededor de una enfermedad.
expectation of
Tenemos
life
dos
that a
curvas
patient has
diferentes. Estoy
when it comes to their
tomando el
life.
ejemplo de lo que
And for
ocurre para
example,
cáncer de
what you have
pulmón,
here is
y para que ustedes
in
puedan
lung
ver
cancer,
la perspectiva en el eje más bajo
in
de
the
las curvas,
lower X
alrededor de
from
lo que
the curves,
ocurriría a un término temporal
this is
extendiéndose hasta
what
los
it
5 a 10
happened
años.
in
¿Qué es
5 to
importante
10
de cada
years.
uno de
What
estos
is the
cuadros donde
importance of
ustedes ven
each one of
diferentes
these
curvas? Pues que aquí van a ver, en
charts?
este caso,
Well,
enfermedad
what you
hepatobiliar, o
would
sea,
see
cáncer de
is
hígado. Aquí van a ver lo que ocurre normalmente para cáncer gástrico,
cancer,
cáncer de
gastric,
páncreas y así otras
pancreas
patologías.
cancer.
Lo más importante es que en todas
The
las
most
curvas
important
ustedes van a ver
of these
diferencias
things is that you're going to see
sustanciales en los
substantial
diferentes
differences
puntos
in the
con
different points with
significancia, o sea, con un
meaning,
significado válido
a
desde la
valid
perspectiva
meaning
de
from
investigación
the
alrededor de
investigation
la
perspective
importancia de tratarse en centros
around
que en los
of
Estados
the
Unidos se
importance
conocen
that
como
can be
Comprehensive
treated
Cancer Centers y lo mismo en
in
Europa,
centers called
y
as
que en América
comprehensive
Latina se llaman
cancer
como
centers.
centros de
In Latin
tratamiento
America,
integral
they're
del
called
cáncer.
centers of
¿Por
treatment
qué
of
es
cancer.
importante esto?
Why
Porque
is this
normalmente las
important?
curvas de mayor
Because
beneficio, que es lo que ustedes
the
pueden ver
most
en la
beneficial
imagen,
curves,
son
which
especialmente para
you
los
can see in
pacientes
the
que tienen la
picture, are
oportunidad de
especially
tratarse en centros de alto
for
débito,
those
o sea,
people who
centros que
have the opportunity
concentran
to be
grandes
treated in
concentraciones o grandes
centers
cantidades
who
de
have
pacientes. Eso
a lot of
implica que
patients.
hay unas
That
curvas de
means that some
conocimiento
curves
y
of
esas curvas de
knowledge
conocimiento normalmente cuando se
and
alcanzan y se
they are
mantienen,
reached and they are
logramos
maintained.
los mejores desenlaces para nuestros
When they are
pacientes.
reached and
Eso es lo que
maintained,
traduce
we
esto
obtain the
de forma
best
más o menos
results.
sencilla. Esto nuevamente es una
This is
comparación. Aquí
also
estamos
another
hablando de cáncer de
comparison
seno y acá en la
in,
otra perspectiva estamos hablando de cáncer de pulmón.
in
Y simplemente
we
para
have
que
two types
ustedes
of
puedan
cancer in this
entender, lo
presentation.
que está
And
hacia este lado tiene el mayor
what I'm going to show you
beneficio respecto
with
del
the
control
arrow
de la
to the
enfermedad. Lo
left
que está hacia el
is what
lado
is the
contrario
beneficial
tiene un beneficio
with
menor
controlling
que
the
el mejor
sickness,
de los
and
beneficios.
the right
Lo que
arrow
ustedes
is
observan en
a
estas
less
dos
beneficial
líneas
part.
es que los
These two lines
pacientes
is that
tratados de
patient
forma
means that two
regular,
patients that have been
incluso
treated
por el ajuste de
in
muchas
a
variables diferentes,
regular
tanto las
basis, even when we have
socioeconómicas como
different
adicionalmente las variables que están asociadas con la enfermedad, o
factors
sea,
that
las
can affect
biológicas
these
intrínsecas de la
patients,
patología,
like
favorecen a
socioeconomic
los centros de
factors.
alto débito, o sea,
Even with those
favorecen a los
factors,
centros
these two
donde el
variables
tratamiento es
are
integral.
favorable
Lo que
when
quiere
there is
decir
a big center
que lo
with
que
a lot
ocurre en
of
muchos de
patients.
nuestros países, la
So
gran mayoría
what
no
it
es
means
correcto. Voy a poner el ejemplo
in
en
our
primera persona
countries
para lo
is
que ocurre en
are
Colombia.
not so
En
good
Colombia
in many
tenemos una
countries. Let
amplia
me give you an
cobertura en
example in
salud,
Colombia.
que es más o
In
menos
Colombia, we
alrededor del
have a
48%
wide
y tanto, pero tenemos un
health
problema muy grande
coverture,
y es
but
que
we
en
have
patologías
one
crónicas de
problem
alto
is that
costo como el cáncer,
pathologies of
tenemos
high cost like
atomizados los
cancer,
servicios,
we
lo
have
que
the service
significa que una
atomized.
institución hace la
That means
radioterapia,
that
en
one
otra
institution
institución
do
se hace la
radiotherapy, in
quimioterapia, en otra
another
institución
institution
el
we do
paciente
a
es operado y
chemotherapy, in
obviamente no hay
another institution
integración de
we
todos los
do the
servicios
surgery, and there
a
is not an
favor del mayor
integration
beneficio del paciente.
in
¿Por
favor
qué
of
es
the patient.
importante?
Why is
Pues por
that
lo que estamos
important?
viendo aquí, las
That's what we
diferencias
see now.
alrededor del mayor
The,
beneficio del paciente,
the benefits
sin
are
lugar a
around
dudas, están en el
the
escenario de
benefits
aquellos que
of the
tienen la
patient.
posibilidad de
It's
tratarse más en
with
centros
those who have
grandes,
the opportunity
más
to
en
be treated
centros
in
académicos,
bigger
más en
centers,
aquellos
in
lugares donde se hace
academic
investigación
centers,
clínica
in
con alta
centers where
especialidad y más
there
en
is
aquellos centros donde
investigation,
hay
and
oncólogos,
in
patólogos,
places where you can
radioterapeutas
find
que han hecho
pathologists, oncologists, and
supraespecialidades
those
o
who has
segundas o terceras
made
especialidades
second
por enfermedad. ¿Qué
specializations
significa eso? Como me
by
ocurre a mí.
sickness.
Yo
That
hoy en
is
día
like
no
my
veo todas
case.
las patologías oncológicas, sino que veo
Today
solamente una
I'm not
circunscripción, un grupo
watching
de
all the
patologías
pathologies. I'm
que no se
only in a
extienden a
group
más
of
de dos o tres.
pathologies
Las
focusing on
recomendaciones
those two.
internacionales de
And
las
that's the
asociaciones de cáncer más
recommendations.
importantes
International
están a favor
recommendations.
de que los
They are in
oncólogos que
favor that
tenemos contacto en
oncologists who
centros
have
académicos de alto
control
débito,
of the
ya sea en
academic
países
centers
desarrollados o en
in
vía de
developed
desarrollo,
countries
ojalá no
or
veamos
not
más de
in
2 o
developed
3
countries.
patologías.
They
¿Por qué?
recommend
Porque
us to not see
la
more of 2
investigación
or
en
3
cáncer es
pathologies.
explosiva,
Why?
es una cosa
Because the
gigantesca.
investigation of cancer is
Tanto así
exclusive.
que para todos
It's
ustedes,
a
y
huge
es
thing.
importante que lo
It's
sepan,
important for
la
you to know
patología
that
sobre la que más, o la
pathology
enfermedad sobre
that
la que más se
more
investiga, más se estudia en el
investigation has
mundo,
been made,
es el
it's
cáncer.
cancer.
Cerca del 62%
Close to
de toda la producción
62%
científica del
of
planeta
the
está
whole
concentrada hoy en día en esta
investigation,
enfermedad. Por eso
scientific
los
investigation
adelantos
of
han
the
sido
world is
tan
in cancer.
dramáticos en periodos
That's
tan
why
cortos de tiempo.
the
Digamos
advances
que
have
para
been
que sea
so
muy
big
fácil de
in a short
comprender,
period of time. Let
en
me
el
explain
año
it
2000,
simpler.
cuando yo empecé a hacer
In
oncología,
2000, when I
pues las
started
cosas estaban muy
doing oncology,
circunscritas y los pacientes
all the
tenían muy
things
pocos
were
beneficios con muchos
very
efectos
close,
adversos.
very small,
Hoy en
and
día es todo lo contrario. Los
patient didn't
pacientes
have too
tienen
many
pequeños
benefits, but
efectos
now
adversos o
we have
moderados a los
few
comunes y
adverse
grandes
effects, and
beneficios
the patient
temporales en
had a
calidad de vida
lot
como
and
se
big
busca.
success and
Esto es lo mismo,
benefits.
simplemente para que ustedes
This is
puedan
the
observar
same
las
graphic
diferencias, en este
than the
caso en
other one,
cáncer de
but
pulmón,
you
que es
can see
parte de lo que
different
yo hago.
data here. This is for the lung cancer. This is the difference in academic center, the red line. As you see, we have a positive inclination. These are for the patient who have been treated in a big center, in difference with the places where are small, which is the blue line, and they additionally doesn't have so much technology. Another other thing that is important for us for the lung cancer, and that Claudio mentioned, is that one of the sickness that has been transformed is the cancer, so much that as you can have a significant impression. For example, the tabacism has been raising the number of people who smoke, but in one decade, the number of people who died by lung cancer hasn't changed. But in just one decade, we have been able to change it, and that have three main reasons why it changed, and this is precisely for glandular tumors. We have an opportunity to find it early. Now, to the smokers, we can do this same test to know early. And another is the immunotherapy. For many patients with lung cancer or neck cancer or cancer Merkel cells cancer or melanoma or kidney cancer, all those sicknesses are grave, and those they have a lot of mutations, and that means that our protection cells from our body can fight against them. Let me explain. The immunotherapy gives special weapons with an army that used to fight with arrows, sticks, and rocks. And now we can cure the metastasis sickness. This is something we didn't have opportunity to do, and that's a significant change. This is a lot of information, but I want to try to make it very simple. Now, we're going to talk about what normally occurs to some treatments. What happens if the surgery it's made in a place where we have a lot of patients, or a lot of patients who are treated in an academic space with the best guides in intervention? Pues it happened the same. Those centers where we have more people that are being treated in the lines, the yellow lines is for pancreas cancer, rectus cancer, or lung cancer, or the extraphasic union cancer. All the patients who have been treating themselves in bigger centers, they tend to have better endings for their sickness. And how many patients those centers must operate? Well, they should be 20 for extraphasic union, would be 20, and if we want to see as an overall, then the numbers are 96, 74, 48, and 178, which means that these are big places, and they have the capacity to reproduce patient to patient the best result. What do you see here? It's the reduction, is the number of times that reduce the times when the patient can have derivative results in different cases when are treated in centers where there are a lot of patients against places where we don't have so many patients and where there are not oncology surgeons. The same occurs in these curves. In this perspective, it's better to understand it's how much need to be reduced the possibility to die in the postoperative period period
intervención en un
if
centro grande
the
a si se hace
intervention
una
is done
intervención
in
en
a
un
big
centro
center
pequeño.
against when
Pues
it's
hay
done in a
números tan
small
densos
center.
como ocurre de forma
There are
regular para
numbers
los cánceres de
so big
páncreas
as
o como
for
ocurre de
the
forma regular para los cánceres de pulmón,
pancreatomy
donde las
or
resecciones
the lung
en el
reaction
mejor de
in
los
cancer.
escenarios
In
y
the best scenario,
concentralización de los casos,
when we
sin
have
lugar a
cases
dudas,
centralized,
repercuten sobre las mejores
we
posibilidades
have the best
terapéuticas.
possibilities for people who are
Este
sick.
es otro estudio muy
This
bonito.
is
Aquí son curvas
another
como las que les mostré
study
al
who's
principio,
really
pero están
beautiful.
invertidas
These curves are
simplemente para que
inverse
ustedes vean lo que
only
ocurre.
for you
En
to
este
see
caso
what
es
happens
el
in this
número de
case.
pacientes y
In
aquí
this
está el
case is
número
the
de
number of
años en la
patients and
posición
the number
inferior.
of years.
Aquí estamos hablando de
Here
la
we are
supervivencia
talking
para
of the
pacientes con leucemia
survivors
linfoide crónica tratada por
for patients who
hematólogos
have
generales y
chronic leukemia.
hematólogos oncólogos
These
supraespecialistas en
are
leucemia linfoide crónica.
treated
Uno
by
de los grandes
oncologists that
problemas
has
que
been
tenemos en América Latina es el déficit de especialistas.
for
En mi
specialists.
país, por
In
decir
my
algo,
country, for
tenemos
example,
alrededor de
we have a
200
deficit.
oncólogos.
We have only
Para un país de
200
50 millones
oncologists
de
for
habitantes, el déficit
50,000
estimado es alrededor
people.
de más o menos entre
The
450 y
range
620
should be
especialistas. Y esto es
500
algo
specialists
transversal.
for
El
all of
único
us.
país
This is
de
something
América
hard.
Latina
The
que
only
no tiene
country
deficiencias,
who
los
doesn't
grandes,
have a
que no tiene
deficit,
deficiencias reales,
a
sino
real
deficiencias
deficit,
por ahora,
by
es
now
Argentina.
is Argentina.
El resto de los países que
Other
tienen más de
countries
20
who have
millones de
more than 20
habitantes
million of
tienen déficit de
inhabitants, they
especialistas.
have
Y hay
deficit
otro problema
with
aún más grande.
specialists. And we have a
En los centros
bigger problem.
académicos relativamente
And in
grandes,
academic
tenemos
centers, we have
especialistas en oncología,
specialists
pero
in
tenemos muy
oncology, but we
pocos
have
especialistas por
few
patología,
specialists
o sea,
by pathology. That
supraespecialistas.
means
¿Qué
super
significa eso?
specialists.
Hay
What
muchos
does that mean?
oncólogos que ven
There are
todas
many
las enfermedades,
oncologists who see
pero hay muy
all the
pocos
sickness,
oncólogos
but
que
there are
ven
few
pocas
oncologists who see
enfermedades.
few
Cuando
sicknesses.
tenemos oncólogos
When
que
we
se
have
dedican a ver una sola
oncologists
enfermedad,
who
pues
only
las
see
curvas son
one
tan buenas como esta.
sickness,
Este es
we
el
have
caso
curves so
específicamente
good
cuando el
at
tratamiento
this.
lo ejecuta
This is
un
a case
especialista
when
en
one
hematología
specialist
oncológica y
in
particularmente
oncology
cuando ese especialista es
is,
súper
and
especialista, o
when
sea,
that
es una
specialist is
especialidad
super
adicional en el
specialist, what
tratamiento
means
de esta
he's only
enfermedad.
specialist in
Y
one
eso repercute
sickness,
sobre las posibilidades de
and
la
that
supervivencia
affect
libre de
the
progresión
possibility to
y sobre la
survive
posibilidad de la
from the
supervivencia
patient
global. O
and
sea,
the
son los
global
desenlaces más
survivance of all
importantes
the sick.
indudablemente. ¿Por qué es importante
And why
superespecializarse
it's
en general? Y
special,
por
the
qué el
super
primer mundo,
specialization,
Estados
and why
Unidos,
the first
Europa
world,
y
United
algunos de los
States,
países de
Europe, and
Asia
some
van
countries
hacia
from
allá?
Asia go
Primero por
there?
el volumen de enfermedad,
Why?
de
Because
información.
for the
Es una cantidad de
quantity of
información
information,
manejable
it's
para que un
a
oncólogo
huge information.
general
For
pueda cubrir el
one general
conocimiento de las
oncologist can
patologías
cover
más frecuentes, las
the
5 más
knowledge of the
frecuentes,
most frequent, the
tendría que
five
leerse
more
algo así como
frequent
unos 600
pathologies,
artículos
he will
diarios.
have to read
O sea, un libro de
600
1500 páginas cada día,
articles
eso es
per
imposible.
day. That's like
Si yo soy un
a book
superespecialista,
of
pues ese
500
número, que es
pages
así
per
de
day.
grande, puede reducirse
If
a
I
un
am
número
especially if
inferior. No
only
voy a alcanzar
one
a albergar todo el conocimiento, pero sí voy a
specialty,
poder
that
manejarlo
number
mucho
it's
mejor.
reduced,
Voy
and
a
I'm going
poder
to be able to manage it
descremarlo, voy a
much
poder
better. I'm going to be able
seleccionar
to
lo más
select
importante
the
para mis
most important
pacientes.
for my
Voy a
patients.
poder armar grupos
I'm going to be
multidisciplinarios donde
able
se
to
divida la patología.
build
Me explico.
multidisciplinary
Una de las
groups
cosas
where
que
are
hablaba al
divided
final
by
Alicia, es que yo soy
pathology. One of the things that
especialista
Alicia
en
mentioned,
oncología y
if I
luego
am
hago
a
oncología
specialist
torácica y me dedico
in
a hacer cáncer de
thoracic,
pulmón, pues de pronto yo me puedo
I
dedicar a hacer cáncer de pulmón
specialist, and now I
avanzado
can
y otro de mis compañeros puede
dedicate
hacer
to do
cáncer de pulmón
advanced
temprano. Eso es muy importante
lung
para aumentar la
cancer, or
eficiencia,
another of my companion
pero
can do
adicionalmente es muy
low
importante para aumentar
lung
la
cancer,
experticia.
and that
Es
is
importante
better
para
to be
promover
more
las segundas
expert,
opiniones,
to
que
have
son
an
esenciales.
expertise.
En esto hay algo que ustedes tienen que
And this is something
entender
you
como
must
pacientes
understand
y
as a patient and
empoderarse.
be able
Uno de
to
los
have
grandes
the
problemas
power
que
to
tenemos también
ask.
en nuestra
That's
región
one of the
es que los
problems that we
pacientes y
have
sus
in our region,
familias
is that the
no
patient and
están
their
bien
families,
empoderados.
they don't
En
have the
Estados Unidos y en
power to
Europa esto
ask.
es
In
enorme.
the
Los
United
pacientes
States,
tienen una voz
that's big.
crítica,
The patient
solicitan
have
apoyo,
voice.
buscan una
They
segunda
ask for help.
opinión,
They ask for a second
buscan ellos
opinion.
mismos los
They
protocolos de
search for
investigación
the
donde pueden
investigation
participar,
protocols to be
preguntan
able to
activamente en la
participate. They
consulta y esto es
ask
una
actively.
cultura que se debe
And this is
gestionar
a
y
culture
que
that
se
needs
debe
to be
gestar
gestionated,
alrededor de los pacientes.
and it needs to
Y
be
deben
developed by the
cultivar
patients,
la
and you
generación de
need to
conocimiento propio,
cultivate your
que es
own
otro de los
knowledge.
grandes problemas.
And that's another of
Resulta que hemos
other
aprendido
problems. We have
especialmente en esta
learned
última
in
década
this
y
last
media
decade
que el
and a
cáncer
half
que
that
nosotros
the
vivimos
cancer
en
that
América
we
Latina
have
es
in Latin
diferente
America
al
is
cáncer de
different
otros
from
sitios.
cancer from
Voy
other
a poner
places.
nuevamente el ejemplo del cáncer de pulmón porque es el más
I'm going to
sencillo para
give you an
mí y
example,
porque
the lung lung
realmente es un
cancer
ejemplo
because
muy
it's the
representativo.
easiest for all of us. And it's
Resulta
a
que
very
durante
representative
2 o
example.
3 décadas pensamos que el
It
cáncer de
happens that
pulmón
for
y
2 or 3
particularmente los
decades we
tumores
used to think that
glandulares
the
eran
lung cancer,
iguales
and
en
especially the
Colombia, en
glandular
México, en Brasil, en Argentina, en
cancer,
Perú,
they were the
que
same
como
in
se
Argentina,
comportaban en
in
Estados
Peru,
Unidos y
and
en
in
Europa.
United
Y
States and
resulta que
Europe.
en esta última
And it
década hemos aprendido por
happened
estudios de ancestría
that
que
It's
realmente el
not.
cáncer de
It's not like
pulmón
that.
entre
The
los
lung
latinos
cancer
se
among
parece al cáncer de pulmón de los
Latinos, it's
asiáticos
similar
y
to
que los genes
lung
que
cancer between
generaron
the
el cáncer de
Haitians,
pulmón entre los latinos son
people
genes
from
de los
Asia.
asiáticos,
So
no
the
de los
genes that
caucásicos, no de los
from the
blancos
cancer in Latin
americanos
America is
europeos.
from people
¿Eso
from
por qué es
Asia.
importante? Porque la
And that's
presentación de
important
mutaciones
because the
especiales que se
mutation,
pueden
the special
controlar con
mutation
medicación
that
por
can
vía
be
oral viene de la
controlled by
población
oral
asiática
way,
especialmente.
it comes
Y esto
from
es
Asia.
importantísimo para la toma de decisiones.
And that's
Esto abre los ojos sobre la
much
importancia
more
de hacer
important
biología molecular,
because
de
open
hacer
the doors
genética
of
tumoral en la mayoría de nuestros
biological,
pacientes. Y sin lugar
molecular
a dudas,
biology.
es algo muy importante. ¿Cuáles son
And this is something
las
very important.
limitaciones de hacer lo
What
que
are
estamos
some of the
hablando de las
limitations
subespecialidades?
of
Pues
this,
en
of the
grueso, los requerimientos de
subspecialization?
de una
Well,
mayor cantidad
we need
de
a
personas.
bigger number of
Obviamente
people.
limitan un poco la práctica
That
porque se requieren más
limits
pacientes,
more
entonces en
practice,
prácticas
so we need more,
pequeñas o en
more
instituciones
patient,
limitadas porque son
or
pequeñas,
we
es
have some
difícil tener este tipo de
situation
subespecialidad.
that are limited because
Limitan
they're small.
adicionalmente las áreas
They
rurales
limit
y
the
adicionalmente se
rural
requieren
area because
competencias
they need
y la gran mayoría de las veces
competences,
que las personas hayan estudiado por fuera.
and it's needed that
Lo otro
people
que es
need to
crítico
go
para nosotros
outside
dentro
of
de
their
los
place to
centros
study.
de alto débito y adicionalmente en los centros en donde
Another
es muy
thing
importante
that it's
tener la
important to
información
have
es el
the
tiempo.
information is the
Resulta que nos
time.
hemos dado cuenta,
We
especialmente a
have
través de estos
noticed
últimos 20 o 25
in the
años,
last
que
20 or
el tiempo
25
desde el
years
momento en el
is
cual
that
se
the
hace una
time
cirugía
between
hasta el
is
momento en el cual yo
a
inicio un
surgery is done
tratamiento
until
complementario es
when I
esencial.
have a
Estos
complementary
son las mismas
treatment, it's
curvas que ustedes
essential.
vieron al
These are the
principio, la
same
curva de
curves that
arriba
you
tiene más
saw at the
beneficio, la
beginning.
curva de abajo tiene menos beneficio.
The
Esto que
top
ustedes están
curve has
observando
bigger
aquí es
benefit,
cáncer de
the
pulmón
lower
y estas son las
curve has less
posibilidades
benefit.
de
These are the
supervivencia
possibilities to
si el
survive
tratamiento
if the
médico, o sea, en
treatment,
este
if the
caso,
medical treatment
inicia tanto la cirugía como
starts
adicionalmente el tratamiento
with the surgery
complementario
and
con
with the
quimioterapia,
complementary
inicia
treatment with
antes de 6 semanas
chemotherapy
después
starts
la ejecución, digamos, de
before
la
of 6
cirugía
weeks
o
of the
después
surgery or
de que se ha hecho el
after that
diagnóstico
the
de la enfermedad
diagnosis
con los tratamientos
has been made
sistémicos.
with the
¿Esto qué
systemic
quiere decir? Que si yo me demoro
treatments.
mucho tomando
That
las
means that if I
decisiones
take too much
o si
time
me demoro
deciding,
mucho
or if I take too
ejecutándolas, que
much
es lo que
time
pasa muchas
doing
veces en nuestro
things,
entorno
which
por
tends to
falta de
happen
acceso,
by
pues
lack
esto
of
impacta negativamente el
decision,
desenlace de los
that
pacientes.
affect negatively to the
¿Por qué son
patient.
importantes los centros
Why
que son
are so important
superespecialistas, los centros de
the
alto débito y los
the
centros
centers of
integrales?
great
Porque aparece un concepto que ustedes ya vieron
capacities
con
and
Alicia y
of
seguramente también con Claudia, es el
integrality?
concepto
As you
de
saw
el
with
manejo
Alicia,
multidisciplinario.
we
Pues el
need a
manejo multidisciplinario es
multidisciplinary
como si ustedes estuvieran
approach.
viendo un gran blanco de esos
It's
donde
like
uno tira
if
flechas, donde
you
uno tira
were looking
dardos.
to a
Hay
place where you need to throw
grupo
arrows.
interior
There is
dentro
a
de ese segmento
interior group
que es
in this
muy
place
importante, que son
that is
esto que ustedes
very
observan
important.
acá,
That is
que son
that what you can see,
el
which is the
radioterapeuta o el radiooncólogo, el
radiotherapist,
oncólogo,
the oncologist, the
algunos médicos de
radio
soporte que pueden
oncologist,
ser
other
internistas,
internists,
en este caso enfermería, que es
also
muy importante,
nurse
los
and
patólogos y los
pathologists and
cirujanos.
surgeons.
Y en la porción externa,
And
pues
in the
está todos
external
los que nos apoyan de
portion,
forma
we
regular en la
have
toma de decisiones.
all the people who always
Genetistas,
help us, the genetists, the
radiólogos
radiologists,
intervencionistas,
intervenionists,
cuidados,
radiologists,
paliativo, medicina
palliative,
nuclear, etcétera,
supportive,
etcétera.
nuclear medicine.
Esto es una diapositiva muy
This
compleja, pero
is
la voy a
a
resumir
very
de una forma
complex
muy sencilla.
slide, but I'm going
Y
to
es que
summarize
cuando
it in a very simple way.
participamos
Is that when we
específicamente en lo que se llama
participate in
tumor
something
board
called
o
tumor
mesas
board
de
or
discusión
discussion
para tomar las
tables
mejores
to
decisiones
take
de
the
los
best
pacientes,
decisions for the
hay
patient,
cosas tan
there are
sencillas
some easy
como
things
sentarnos a
that are
planificar
so
el
easy
tratamiento del
as to
paciente
plan
que
what is going to be
impactan
the
de forma
treatment in the
muy
patient that
positiva el
impact
curso terapéutico.
positively
Tanto
in
que
the
mejoran el
therapeutic
curso de las
course, so
decisiones,
much that they
mejoran
improve the
adicionalmente la
decision
capacidad de
course,
revisar los
they
casos de
improve
forma
the capacity
integral,
to review
mejoran los
the things
desenlaces
in
a
an
largo
integral
plazo
way,
y sin lugar a
and
dudas
they
termina
improve
traduciéndose en muchas
the
veces en mejora de las
the
posibilidades
capacity
terapéuticas.
that the people is
Esto es
going
lo
to have
mismo
to
y es las
survive.
posibilidades de cambio
And
que
it's the
tenemos
same
alrededor de poder
for
tomar decisiones en
those
un
who
grupo multidisciplinario.
need to have
Simplemente para
this
que
take
ustedes vean un
decision in a
ejemplo, aquí en esta
multidisciplinary group.
porción, pues estamos
Let me
viendo
show
el
you an
caso de
example.
cáncer de seno
We have
y de cáncer gastrointestinal.
a GI cancer.
¿Cuántos de los oncólogos que están
How many
comprometidos en este caso en los
oncologists
Estados Unidos en la encuesta
that are
participan
committed
de
in
grupos
this
multidisciplinarios, de
survey,
mesas de
they
discusión y
participate in
toman
this
decisiones sobre sus pacientes? De cada 100
tumor
pacientes,
boards?
¿cómo los
From
estructuro yo?
100
Pues en Estados
patients, how
Unidos
are
el
they structured?
44%
How
de
are
los que
they
ven de forma
structured?
regular
With the
tumores
40%
gastrointestinales llevan a sus pacientes a una
of this
mesa de
doctor, they
discusión.
take
El
these patients to
17%
a
nunca
tumor
lo
board.
hacen y
The
probablemente estos son
17
los pacientes que
of the
tienen
patients,
menos
they are
beneficio
never taken
y
there.
el
So these are the
38%
patients that who
solamente en algún
never
caso.
have an
Y
opportunity
algo
to
parecido
for those
ocurre para
benefits.
cáncer de seno,
And
como ustedes lo
something
están observando acá.
similar occurs
Entre más
for
veces se
this
presenta un
another type of
paciente en un grupo
cancer.
multidisciplinario,
The more
mejor son las
time that that
decisiones.
patient is presented in
Nuevamente
a
las curvas, lo que
multidisciplinary
ustedes
group,
acaban de
the
ver,
best,
este es el
the
caso de
better
la
are the
supervivencia
results.
libre de progresión de la enfermedad, que
This
son
is
los
how the sickness
intervalos
has been
entre tratamiento
progressing
y tratamiento para enfermedad
between
metastásica. Pero lo más
treatment and treatment for a
importante de esto
metastatic
es comparar
sickness.
eso.
But the most
Si
important of
ustedes
this
ven
is to
aquí,
compare
las
these
decisiones
two.
hoy en día se volvieron mucho más
Decisions today
complejas
are
porque
much more
incluyen la
complex because
genética.
they include the
Entonces tenemos que tomar
genetics.
decisiones para los
So we
pacientes con
need to
base en los
take
resultados de la genética de
decisions
sus
based on the
estudios.
genetic
Resulta que
studies.
si yo presento mi
It happens that if I
paciente
present my patient
múltiples veces
many
en una
times
reunión
in a
donde haya
meeting where
integralidad
there is
alrededor del
integrality
conocimiento genético de la
around the
enfermedad,
genetic
las decisiones
knowledge
quedan
of the sickness,
mucho
the
mejores y
decisions will
más
go
claras.
much
Y tiene que
better.
ver con la
And it
cantidad
have
de
to
genes
do
que de
with the
forma regular
type of
tenemos que
genes that we
entender.
have to
La gran
understand.
mayoría de la enfermedad está contenida en alrededor de 400 a
In
600 genes
400 of
y
genes,
por
the sickness
patología más o
is
menos son 6 a 12
contained,
a
and
12
from 6
genes
to 12
para tomar
genes,
decisiones en el
the
mejor de los
pathology is
escenarios.
focused.
Esto simplemente
And this only
todas
means
las
all
posibilidades
the
de diagnóstico que
possibilities of
tenemos hoy en día
diagnostic that we
para
have.
que sea
Let
sencillísimo
me
de
explain
entender.
simple.
Hagan de cuenta que yo cojo la
Let's say that
patología
I
del
take the
bloque de
pathology
parafina, el bloque de cera donde está guardado su tumor,
in a
extraigo
place. I have your
esa
tumor in my
patología
hands.
del
I
bloque de cera,
extract the pathology.
hago un análisis del
I made an
ADN y
analogy
hago un
from the
análisis del
DNA, an
ARN, este es
analogy
el que
from the
lleva los
RNA.
mensajes,
This
este es
is
el que
one
guarda la
who take the message,
información
and the
y buscamos a
DNA
través
is the
de
one who saves the
cualquiera de estas
information.
plataformas
And
y
we search in
máquinas
these
las
platforms,
posibilidades
these
de
machines that
catalogar
we
la
have,
enfermedad.
the
¿Por qué es
possibilities to
importante?
catalog
Porque hasta
the
hace algún
sickness,
tiempo conocíamos el
because
nombre de la enfermedad,
this
pero no
this is a
conocíamos el
time
primer apellido y el
that we
segundo
used to know the
apellido.
names of
Hoy
the
en día
sickness, but
conocemos el
now we
nombre, el
know
primer
the
apellido,
name,
el segundo
the first
apellido
name,
y ahora
and
estamos viendo
the
más adelante
title,
dentro del
even if we
árbol
want.
genealógico de cada una de esas enfermedades. Es tan importante que el
It's so
40% de
important
las
that the
decisiones
40% of
de los
decisions
pacientes o
from
sobre
the
los
patient
pacientes
or about the
cambian
patient
alrededor del
change
conocimiento genético de la
around the
enfermedad
knowledge of the
cuando los
genetic
médicos
knowledge of the
solicitan
sickness
este
when
tipo de
the
información. Hay patologías donde esto es
doctors
un estándar
ask
de
for this
tratamiento
information.
o es un
There are
estándar de
some
oro para
places
tomar
where
las
this is
decisiones y
a
hay patologías
golden
donde no.
standard to take
¿Dónde es un
decisions.
estándar? Cáncer de pulmón, cáncer
Where
de
is an
colon,
standard?
cáncer de seno,
Colon cancer,
algunos tumores raros,
lung cancer,
sarcomas de tejidos blandos, tumores cerebrales.
sarcomas
Son tumores
from
donde sin
soft
lugar a dudas se
tissues.
necesita de forma
These are
absoluta el
places where
conocimiento
we
sobre la
need
genética.
an
¿Por
absolute
qué? Porque es
knowledge of
importante para
genetics.
poder
Why?
cambiar
Because it's
las
important
posibilidades
to
alrededor
change the
de las
possibilities
mejores decisiones. Porque es
to
importante
the
ir
best
por el uso de medicamentos
ending.
particulares, en
And
especial
because we
en
have
protocolos de
special
investigación, que es lo
medicines
que
that we
ustedes
can
están
use in
observando aquí. Y porque
investigation
adicionalmente, sabiendo
protocols.
la genética,
And because
podemos
knowing
invitar a
the
nuestros
genetics,
pacientes
we
a
can
recibir
use,
intervenciones complementarias
we
que
can
antes
invite
no
our patient
conocían.
to use complementary
Esto es
interventions that
simplemente
we
cómo se
didn't
captura
used to
la
know.
información alrededor de los
This is how
pacientes
the
y
information
de
is
las
captured
posibilidades
surrounding the patient
terapéuticas,
and the
las reuniones. Entonces se
therapeutic
presenta el caso de
possibilities.
cada uno de los
Then
pacientes en estos
in the meeting,
tumor boards, en estas
it's
mesas de
presented
discusión
the patient in
genética
this
y
tumor
sobre el
board,
caso del paciente
and
se
the case
revisa
of
el
the patient,
resultado,
it's
se
review
hace
the
una
result.
discusión integral de cada
We
uno de
have
los
a
datos,
discussion of
muchas
an
veces se
integral discussion of
revisa
the
también a la
data.
familia y
Then
se hace
the
una serie de
family,
recomendaciones
it's
alrededor de la mejor
checked and
terapéutica
they
posible.
receive the
Y una
best
de las cosas
suggestion.
más interesantes es que
And
cada día
one
tenemos más
interesting thing is that
recursos
every day we
por
have more
inteligencia
resources
artificial,
with
especialmente
artificial
por
intelligence,
bases de datos
especially
relacionales,
for
para buscar casos similares
connecting
que nos
in
permitan
similar
guiar nuestras
cases that
decisiones.
can help us to
De nuevo, las
guide
curvas,
our decisions
este tipo
better.
de información
Again, the
mejora
curves,
las
this
posibilidades de los
information
pacientes,
improve the
tanto en
possibilities
tiempo
from
de
the
control de la
patient,
enfermedad como en supervivencia global,
also to
en todos los
survive
escenarios,
globally
y
in all
especialmente
the
nos permiten
scenarios.
subseleccionar
And it
y
helps us to
estratificar las
subselect
mejores
and
matches, las
stratify
mejores
the better
uniones entre el
matches between the
diagnóstico y
diagnose,
medicamentos especiales que
the
podamos tener para
diagnosis, and the
ustedes.
medicine that we
Puede
can
mejorar
offer.
adicionalmente la supervivencia
And
libre de
we
progresión
can
y global,
help
y tenemos
to improve the
clasificaciones para los medicamentos hoy en día.
survivance.
Son medicamentos que
And
están
today we have so many
autorizados
medicines
muchas
that has
veces
been
por agencias
authorized.
regulatorias como la FDA,
It has
o
been
hay
authorized
medicamentos
by the
que no están
FDA,
autorizados y que deben
and there are
utilizarse
others who
bajo
are going to be
el formato de etiqueta abierta o
used by
ustedes
the
lo van a ver
open
como
etiquette
off-label
or
para
off-label
emplearlo en
because they
algunas de
are
las patologías, pero obviamente se requieren las
free, but
discusiones
you
multidisciplinarias
need the
para trabajarlas.
multidisciplinary discussion
En
to
conclusión, y
recommend those.
simplemente
And
para
in
traer una
conclusion,
cosa alegórica,
and only to
entre mejor sea el
mention this,
centro,
in
entre mejor
if the
sean los
center is
desenlaces,
better, if
entre
the
ustedes más
endings are
puedan
better,
pedirle a
if
sus
you
médicos y
ask
a
your
sus equipos
doctors and
que
your
nos
teams
muestren la
to show us the
información sobre
information
lo que han logrado
about
sobre sus
what they have
patologías,
reached in their
sean patologías
pathologies, if
frecuentes,
they're frequent
sean patologías no tan
pathologies, if they
frecuentes,
are
o
not so
sean
frequent
patologías
pathologies,
realmente raras,
or if they are
sin
very
lugar a dudas
weird
es
or
mejor.
strange
No desconfíen de
pathologies,
los centros que hacen investigación, confíen en ellos.
you
Hoy en
feel
día
that
sabemos que los
maybe you
pacientes
don't trust in
que se
the
exponen a la
investigations in them, but
investigación tienen
trust
en
in
la
them.
enfermedad
The
avanzada
patient who are in the
2.4 y
investigation
5 veces más
center, they
posibilidades de
have
vivir.
2.4 or
Y eso es una realidad.
2.2
¿Por
more
qué? Porque van a tener
possibilities
la
to
oportunidad de
improve
tener
their health
medicamentos que
because they
están aún
have the
en proceso de
opportunity to
evolución y
use
que tardarán años,
medicine
algunas
that
veces
in the
incluso
evolution
décadas en
center
nuestro
that
entorno en
could
general.
take years to reach to
Dialoguen
all the
abiertamente sobre
public.
las posibilidades
Talk
de ir a una
openly
discusión multidisciplinaria,
about the
que
opportunity
la
to go to a
decisión sea una decisión
multidisciplinary
consensuada entre sus médicos
team,
tratantes,
that
desde el
they need
ámbito
to be a
quirúrgico,
decision
desde la
made as a
radioterapia,
team for
desde
your
la
sickness,
quimioterapia, sin
from
lugar a dudas, desde el ámbito
chemotherapy or
oncológico.
radiotherapy,
Y
from the
sin lugar a
oncologic
dudas vale la pena preguntar
sector.
en el centro
And
donde ustedes se vayan a
obviously,
tratar
it's totally
si
worth
quienes
it
les van a ver tienen un
asking if
conocimiento
those
especial
who
sobre
are
la
going to see
patología
you
que
have
ustedes
an
tienen.
special knowledge about the
Eso va a
pathology that
permitir
you
que su
have. That is
tratamiento
going
sea
to
mucho
allow
mejor.
you
Y tal vez
to
la
have a
mejor
better
recomendación que
treatment.
puedo
And
dar
maybe
a
the
través de
best
esta
recommendation I
conferencia, que
can give
seguramente
in
la
this
dieron también
conference
de Claudio
is, and
y
also
Alicia,
Claudio and
es
Alicia will be,
empodérense.
is that
Muchas de
get
las
the
cosas que
power.
nosotros
Many
podríamos
of the
hacer para
things that we could
ayudarles
do to help
hoy en
you
día están
today
fuera de nuestro
are out of
alcance
our
porque no
control
tenemos la ayuda
because
de
we
los
don't have
pacientes
the
y sus
help of the
familias
patient
para
and their
lograrlas.
families to
Y si
achieve
tuviéramos una
this.
mano de
And if we could
ustedes,
have
no
one
hay
of
una
your
voz más
hands,
fuerte que la de los pacientes. La
there
nuestra,
is
la
no
gran
a
mayoría de las
better
veces es una voz
voice
silente,
than the
pero
patient.
frente a la
Our
política pública la de
is a
ustedes es mucho
silent
mejor.
voice, but
Muchas
in the
gracias.
publicity, your voice is much better.
Muchísimas gracias,
Thank you.
doctor Cardona.
Thank you, Dr. Cardona.
Tenemos ahí a Adriana.
We have Adriana with a question.
Adelante, Adriana.
Go ahead, Adriana.
Gracias, doctor Cardona.
Yes,
Como
thank you,
siempre, un
Dr.
gusto
Cardona.
oírlo.
It's a pleasure
Siempre
always to
aprendemos
listen
un
from you.
montón.
We always learn a lot.
Conociendo las
Knowing the
limitaciones de los
limitation from the
subespecialistas
subspecialist
en términos de agenda,
in terms
¿qué
of
tan
time,
espaciados son esos controles
how
de los
frequent
pacientes
are
con
the
ustedes? Me
control with the
refiero a
patient
una
with
persona
you?
recién
I mean,
diagnosticada
a
cada
person that has been
4
recently
versus una que ya lleva un
diagnosticated
tiempo de
against
sobrevida.
someone who has
Pueden acudir
been diagnosticated a long
alternativamente
time ago.
a la junta
Can they
multidisciplinaria para
go
liberar las
constantly to the
colapsadas agendas.
multidisciplinary
No sé, me pregunto
board?
eso por la limitación de tiempo que tienen
I'm
ustedes.
trying to talk about
A
the
ver, lo
limitation of
primero que
time.
tenemos que resolver
Well,
en
one of
muchos
the
de
things
nuestros
that we need
países es
to
ese déficit de
fix fields is the
especialistas,
deficit
esa
in
base. Y una vez
professionals.
tengamos la
And once
posibilidad
we
de
have the
mejorar esa
possibility to
base,
improve
el
that
siguiente
base, the
paso
next
es
step
lograr
is
que las
to
personas se
reach
subespecialicen.
that these
Obviamente
people
tienen que ser procesos
subspecialize.
dinámicos que
Well,
corran al
we need
mismo tiempo,
to
porque
do
no podemos
dynamic
esperar que
processes
tengamos
that
600
run at the same time.
especialistas
We cannot wait to have 600
Entonces, lo que
specialists
necesitamos
to do
es
this.
empezar a
We need to
promover que
start
la
right
gente se
now
empiece
that
a
people
dividir por
start to divide by
patologías, que los
pathology,
centros cada vez
and
tengan
those
mayores
centers
recursos
can
en
have
eso.
more resources.
Los centros o los
The
sitios donde se
centers or the
discuten
places
de
where
forma
are
regular
discussed
las patologías,
the pathologies,
las mesas de
the
discusión, los tumor
tumor
boards, son
boards,
importantes
they
al
are
momento de tomar
important
decisiones muy
when you
grandes.
take important
Entonces, ¿cuál es
decisions
mi
or big
mejor primer
decisions. What is the
tratamiento? ¿Cuál es el
best
mejor segundo
first
tratamiento?
treatment
¿Cuál
or
es
the
el
best
orden
second
correcto?
treatment? What is the best
¿Cuál
third
es el mejor
treatment?
estándar a
What is the
nivel
best
global? ¿Ese
standard in
estándar es
global?
perfectamente
Or
reproducible en nuestro
can
entorno?
that be
En
reproduced in
nuestros
our
países, yo creo que esto es una generalidad
country?
para América Latina, pero
I
lo digo
think
en
this is
primera
something for
persona en
Latin
Colombia.
America,
En
but
Colombia,
for
las
Colombia,
entidades que
in
prestan los servicios sanitarios en cáncer
those
y en general en
places
muchas de
that
las
give a
patologías
service
están
when it
acostumbradas
related to
a
cancer,
mostrar resultados económicos.
they are related,
Es muy curioso,
they tend to
pero
show
no muestran
economic
resultados
results,
alrededor
but
de
they
lo
don't
más
show
importante, que es cómo le fue a los pacientes.
they
¿Cuál
don't
es el
show
desenlace
results
real?
of how
¿Cuál
that
es
helped the patient,
qué tanto mejoró
how
la gente?
much the patient
Entonces, qué
helped,
tanto más ganamos
or
en
how much the
vida, qué
patient
tanto más
improved,
ganamos en calidad de
how
vida,
much
qué
we
tanto más
gaining
ganamos en
life quality, how
control de
much
la
we gaining
enfermedad,
control in the
etcétera, etcétera.
sickness,
Entonces,
etc.,
esas son cosas
etc.
que tienen que empezar
Those
a
are things
cambiar
that
de
we
forma
need to
progresiva.
change progressively.
Y sin lugar a dudas,
And
pues
without
parte de
any
ese
doubt,
cambio
part of that change
está en
is
los pacientes,
on the
está en
patients,
nosotros,
is on us,
en
in
promover todo este entrenamiento,
promoting
en
more
favorecer que haya
training, in
espacios de discusión
favoring
y en
space to
adicionalmente
discuss,
permitir que haya
and
legislación alrededor de ello.
asking for a
Las leyes de
legislation.
cáncer que muchos de nuestros
We
países
have
las tienen
laws
hoy
of
en
cancer
día,
that many of our country
deberían
has
promover la
nowadays.
integralidad,
They should
no
promote the
disgregar.
integrality, not
Deberían promover las
disgregate. They
discusiones
should
a favor
promote
de
the
la integralidad.
discussions
Entonces, las discusiones
relating to
multidisciplinarias y los mejores
integration
recursos para los
and the
pacientes.
best resources for the
Entonces, hay que
patient.
tratar de
And we need
unir
to
eso
try
que hoy en
to
día está
reach,
tan
to
disgregado y
unite
tan
all
atomizado.
those things that have been so separated. Thank you, doctor.
Gracias, doctor.
Thank
Muchísimas
you, doctor.
gracias. Yo
A
tengo
lot
una
of thank you.
pregunta
I have
también.
one question.
¿Hace como cuántos años
How
es
much
que
time
se ha
is
iniciado
that
el tratamiento
it has been started, the
multidisciplinario en cáncer de
multidisciplinary
pulmón en Colombia?
team worked in Colombia?
Depende.
It
Yo diría que
depends.
Colombia es
I would say that
enorme,
Colombia is a
pues dentro de los
big,
países es un país muy grande.
it's a big country. So
Realmente,
really,
si tomo el
if we
contexto
take the
global del
context, the
país, yo diría
global
que hasta
context, I
ahora
would
se
say
está
that
empezando a
we
hacer
are haven't started
discusión
yet. We are
multidisciplinaria. Y lo
starting
digo
right
desde la
now.
perspectiva de
But
las
if we'd say,
instituciones en las que yo he estado vinculado, pues
from the
llevamos
perspective that
alrededor de una década.
the institution has been vinculated, we
Hay que
would say
tener
that
en
it's
cuenta
like
que
10
esto no es
years.
la
But
generalidad. Digamos, en el
let's
caso
say
yo
that
hago
it's not
medicina
the rule.
en instituciones muy
For example,
grandes,
I've worked
en
in very very big
con muchos
institutions with a lot of
que
resources,
no son la realidad
and
del
they are
país.
not the reality
Son
in
la
the
realidad de una
country.
pequeña
They are
fracción,
a
pero
small
no son la
fraction,
realidad de
but
la
they are not the
mayoría.
reality of the more
Esto es lo que
majority.
necesitamos es lograr que
This
sea la
is
realidad de la
what we
mayoría.
need to reach, that this is the
Me explico.
reality.
Es
for
muy importante
everyone.
que las
It's
discusiones
much more important that
multidisciplinarias sean
multidisciplinary
la
discussions
generalidad del
are the
entorno
rule
global,
for
no la
everyone,
generalidad de
not
entidades
the rule
particulares.
for only
Y eso se logra
particular
a través
centers. And that is
de,
reached
del awareness que
through
pueden ejercer
awareness that
ustedes,
can be done
se
through
logra a
you,
través de la
or the
legislación, se
legislations,
logra a través de la
or the
integración, de la
integration,
atención,
or the
de la
attention, or
transversalidad, se
transversality,
logra a través de la
or through
superespecialización
subspecialization
de las instituciones
from
y
the
de sus
institutions
médicos, que
and the
son cosas que
doctors.
evidentemente tienen que tocarse. Y una de las cosas más
And some
importantes
of
que
the most
promueve
important
esto,
things that are
incluso
related to
las
this,
discusiones
and
multidisciplinarias
maybe
en
even
conocimiento
the
alrededor de las patologías
multidisciplinary
particulares, es la
discussion,
generación
is
propia de datos.
the
Estamos muy
generation of
lejos,
data.
¿ah?
We are very far.
De América Latina en
America
general
Latina in general,
representa menos del
it
1%
represents
de la
less than
investigación en cáncer
1%
del mundo.
of investigation of
Entonces
cancer in
necesitamos
the
cambiar ese
world, and we need to
1%.
change
¿Por
that.
qué? Porque ya nos dimos
Why?
cuenta que somos
Because we have
diferentes
discovered that
y
we
que
are
muchas
different,
cosas
and
nuestras
many
no
things
aplican
does not
a
apply
otros,
in
a lo que sabemos de
what
otras
we know from
latitudes.
other places.
Doctor,
In lung cancer, how much how much percentage of the patient can be benefit from immunotherapy, and so no, how much of them can be benefit from symbiosis,
Hablando de quimioterapia
chemical
por síntesis
symbiosis.
química o de inhibidores de tirosinquinasa.
Well,
Depende un poco. En
talking
cáncer
about
de
that,
pulmón, si
it
los
depends a little
dividimos
bit.
por cáncer de
If
células
we
grandes y células
divide
pequeñas,
the lung
y
cancer
hablando de
between big
células
cells
grandes,
and small
fumadores, no
cells,
fumadores,
from the
en
smokers and
los
no
no
smokers, in
fumadores,
no smokers,
usualmente nos
it's
inclinamos más por
usually
el uso
when
de
we tend to
medicamentos como
use
los inhibidores de tirosinquinasa, que son
medicines like
moléculas especiales que cierran
inhibitors.
los genes dañados.
Those
Entre
are
los fumadores es
they
mucho más
close the
eficaz
damaged
la
cells.
inmunoterapia. Entonces,
Um,
digamos que ahí hay
let's
diferencias.
say that there's
Si
some
lo tengo
difference
que
there.
decir
If I would
numéricamente,
say
pues
it by
entre los no
numbers,
fumadores de
we would say
síntesis
that
química
between
probablemente
no
alrededor de un
smokers,
50 a
50 or
60%.
60%,
Entre los
and in
fumadores de
those who are
inmunoterapia
smokers,
el
in
100%.
immunotherapy is different to that.
Que reciben, ¿no?
Those who
Beneficio, pues
receive
también es un
benefits,
porcentaje
but they receive
diferente.
a
Hablamos
different
de
percentage.
el que lo
Let's
debería
say
recibir el 100%,
that those who receive the
beneficio, pues estamos
100%,
hablando
they
probablemente un
receive
60,
like
70%.
60, 70%.
Sí, usted nos ha hablado de la importancia
Yes, you
de
have
tener un
talked to
marco
us about the
legal en
importance to have a
cáncer. Nosotros
legal
tenemos una ley
framework.
específica para
We
el
have
cáncer de
a
pulmón
special law
que
for
incentiva
lung
el
cancer
uso de tratamiento
that
biológico para los
invite
pacientes con cáncer de pulmón y también, claro,
the
los
biological treatment
tratamientos
for
de
patients
síntesis
with lung
química.
cancer and
Y
for
incentiva
synthesis,
también a
chemic
tener guías de
synthesis,
práctica clínica que se
chemical
actualicen
synthesis.
periódicamente y bueno, en los lineamientos para
And
poder
we have
tener un
some
tratamiento
alignments
estandarizado
to have
que
a
se mejore el
standard
abordaje
treatment
del
and
cáncer de
to
pulmón.
improve
En la
the
región no
lung
he
cancer
tenido
treatment. In
reporte
the
de
region,
tener
I have
otras
not had
leyes
another
específicas
report
para
about
cáncer de pulmón.
specific laws
No
for
sé si
lung
usted tiene
cancer. I don't know if
conocimiento
you
si en
have
el mundo
any
hay alguna
knowledge in the world
específica
we
para
have
cáncer
any
de pulmón.
specific law for lung
No, leyes
cancer.
antitabacos, sí.
No, we have a law
Leyes
against
específicas para cáncer de
tabacism, but
pulmón,
no
no.
No,
No,
for
en la región
not for
hay
lung
leyes
cancer.
alrededor, pues
In
las
the region,
leyes de
we have
cáncer que están asociadas a
lung
generar
cancers,
el espacio para discutir sobre la
similar
importancia
laws,
del
but
cáncer
no
como
laws
enfermedad
about
de
that.
salud pública, con impacto de salud pública,
We have some laws
que lo
that,
tienen la
that
gran
impact
mayoría de
the
los países
public
grandes hoy
health,
en día y
that
especialmente donde hay
almost every big
instituciones
country has one of those,
representativas
and especially where we
locales
have
que
a
impulsen
representative
esas leyes, pero
uh,
particularmente leyes de
in
cáncer de
organizations
pulmón
that
no. No, en el resto de la
impose of
región no hay.
those things, but in the region we don't have lung
Doctor, entonces
cancer
el
laws.
camino definitivamente
So,
para
doctor, the
abordar bien
path
el
for
cáncer,
us
cáncer de pulmón, por
to
supuesto,
help
es
in lung
tener
cancer
centros de
is to have
excelencia y
excellent
tener un
centers
abordaje
and to have
multidisciplinario.
Sí,
a
hay algo que no
multidisciplinary
mencioné,
team.
pero creo que es
Yeah,
muy
something
importante
that
y
I didn't
ustedes que
mention is
están desde
something
la
that
perspectiva de los pacientes.
I didn't mention
Digamos,
is
en
something
cáncer
you
de
should
pulmón hoy en
know
día
is
sabemos
as
que son
patient
muchas
is
enfermedades dentro del mismo
for
nombre.
lung
Digamos que es
cancer. We know that there are different
FFR, ALK,
sickness
ROS1,
inside of that name.
NTRK,
Entric, Roswell,
NGR1, o sea, son KRAS, son
LFG1.
un montón de enfermedades dentro del
There
mismo
are
nombre.
different sickness
El
inside
nombre y
one
apellido es
name.
lo que es
The
diferente.
name
No
and
es
the
el
last
mismo, el
name is
apellido
what
es el
is
que es
different.
diferente. Entonces, ¿qué es importante? Digamos, en
So
Estados
what
Unidos
is
y en Europa
important is that
hay
in United
muchos
States
grupos
and
de
Europe,
pacientes
there are
que empiezan
different
a tomar
groups of
delantera
patients who
alrededor
start to
de cada
take
una de esas
the
enfermedades
lead in
particulares.
all
Entonces, hay una
those
cosa que se llama
specific sickness. There is
EGFR
something called
resistors en Estados
EGFR
Unidos, o sea,
resistors.
resistentes de los EGFR. Entonces, se unieron un
So
montón de personas
many
con la
people
misma
who have the same
enfermedad,
sickness
pacientes, no
put
estoy hablando de
together,
médicos, sino de
patients, not
pacientes.
doctors,
Se
patients.
unieron un montón de
A lot of
pacientes que
patients they
tienen
were
EGFR
together who had
positivo y
FGR
crearon este
positive,
grupo.
and they
Bueno,
had this group.
ese grupo hoy
And
en
that group
día hace parte
nowadays
importantísima
has
de
an
algo que se llama Lung
important
Cancer
part
Research Foundation, que es la
on the
Fundación de
Lord
Investigación en Cáncer de
Research
Pulmón.
Foundation,
Y
which
esta
is the
gente ha
foundation to
logrado conseguir
investigate
donaciones
lung
para hacer
cancer,
investigación
and they
propia.
have obtained money to make their own investigation. So less than 6 months ago in the Mundial cancer, lung cancer, they show data of how beautiful has been the gesture that they have done about one sickness to generate knowledge for themselves. And there are some beautiful things. There are certain things that they have obtained molecular tests, they have access to medication of latest technology, they compassional uses. There's something that we don't have in the region, but the pharmaceutical business is trying to give those two things to us, but the patient has started to do that. So those are some things that can make a big difference.
De acuerdo, doctor Cardona. No sé si pueden subir rapidito, por favor.
I don't know if the Dr. Claudio is available. He's in the backstage. Okay, he's leaving. Okay, no. Well, Dr. Cardona, thank you for all your generosity and sharing all this knowledge. I know that your work is of very high excellence, and we are honored to have you here with us. Definitely, the labor of the doctors, it's very important, and to put these needs in place and to understand from the organizations, from patients, all these particularities and all these topics is from great value. I think that excellence centers mark the difference. Not all the public places have the possibility to offer this multidisciplinary help, and we will work on this to have this important resource not to have a society free of cohesion. It's important to have a right treatment and a right diagnosis, and also to have a team of doctors of great quality who can interact, who can guide a little bit the destiny of the patient. We have seen, thanks to you, all these topics so important, and nothing more than thanking you for being with us, and thank you for helping the organization of patients, because in this way we can help the patient, and we can do incidences and put these topics and to change the health system. And no, Carla, thank you to you. And we hope that we can have another opportunity together. Thank you, doctor. Good evening. Take care. Goodbye. Till next time. We stay a little bit more because Alessandra is asking for the picture. She's not calm if we have a testimony of the meeting. If you can turn on your cameras so that Alessandra can take a picture. Thank you, Alejandra Toros. Thank you, Alma Robles. Thank you, Alma Cecilia from Costa Rica. Thank you, Ignacio Cerviño from Argentina. Thank you, Amalia Galindo. Thank you, Omaira from Panama. Thank you, Tatiana Corgo. Please, just 1 minute to take the picture. Alessandra, you let us know. With our listeners from the Facebook transmission, we thank you a lot. We have the same meeting at the same time on December 7th.